All right, welcome. Thank you for joining us today. This is part of the My Rounding monthly webinar series, and today it's on moving at HCAHPS through change psychology. I do want to go through a couple of housekeeping items before we dive in. First, the attendee lines are on mute. If you have any questions, please go ahead and ask those in the questions box on the right-hand side of your screen. Additionally, slides and a recording of this webinar will be available after the presentation. I will provide a link at the end. So diving right in, this is our agenda for today. If you have already downloaded our ebook on HCAHPS success and the psychology of change, you're going to see a lot of these same things appear in the ebook. So we're using the ebook as a foundation for our discussion today, and we'll expand upon those topics and provide stories. If you don't have the ebook yet, or if you haven't downloaded it, that is available in our handouts panel on the right-hand side for you to download. It is free. It's a great resource to have on hand now and in the future. So I highly recommend you do that. I am Katie Anthony. I'm the marketing coordinator for My Rounding, and I will be your host for today. I also am joined by Michael Niederhauser and Steve Bachtel, both of My Rounding. Gentlemen, thank you so much for joining us today.
Hey,
Would you like to introduce yourself?
Absolutely. Hey, everyone. My name is Michael. I've been here at My Rounding for about 3 years, and I work directly with My Rounding customers to help identify goals for rounding, set you up with what you need to succeed from a technology and ongoing support perspective.
And hi, everybody. My name is Steve Bachtel. I'm the Chief Commercial Officer here at My Rounding. I'm really excited about today talking about the psychology of change. This is something that's always been very kind of near and dear to my heart. A lot of my graduate research work was on this topic. Always fascinated to walk into hospitals, and you can usually feel the culture and what's happening inside the hospital just as you walk through the doors. So happy to talk today a little bit about what drives some of that.
Great. Thank you both. So first off, before we dive in any further, we are going to ask a poll question. This should show up on your screen right now, and we just want to know who you are. What is your role in the organization? That way we can get a little bit better sense of who we're talking to and who really cares about this, and hopefully we can cater our conversation a little bit to you. So it looks like many of you are participating in that, so thank you so much for jumping in there. We have quite the mix currently, but the biggest amount of people currently on the line are coming in from department managers.
Makes sense.
We'll give you a few more seconds here. It looks like people are still voting.
So department managers, you have to create change from the middle, and that's always an interesting piece, and I've seen it done. I've seen it done well, so hopefully we'll talk about that today.
All right, it looks like we've finished up here. So as you all can see, we have about 11% executive leaders, 50% department managers, 25% project leaders, 11% care team members, and then about 4% non-staff or consultant roles. So that's a great spread. It's obviously a topic here that applies to everybody, so it's great that you've all joined us.
Well, and this is an interesting study too, because you're looking at, between leaders, department managers, the 25%
project leader
was project leaders, right? So you've been tasked with a project. Lots of different parts of the organization that have to go out and create change. It's laid across all of us.
It is. All right. So let's dive into it.
Great. Well, let's set the stage here. What we're going for through all of this, through change, is high reliability. That may mean a variety of things, but basically what we're looking to do is create error-free operations. One way that we can go about that really is through the course of this presentation. We want to start with something that is called standardization, something we've all heard of. Steve, take us through a couple of points here.
So yeah, and this is almost kind of a little bit of a joke to start off, because we're talking about standardization, but we're about to talk about psychology, because yes, standardization is what gets us there, but psychology is what brings the whole team along for the ride. So from a standardization standpoint, if let's say that you're going for every patient every day, or sometimes we like to call it every patient every stay, if you're out there and you're rounding, and in fact we had this with one of the organizations that we work with, where their goal was 10 patients per week, and to try to drive HCAHPS in this case. Now, of course, the problem with that is that one particular unit might have 80 patients on the unit, and the leaders were out there conducting 10 rounds across these 80, and then they were getting about 8 surveys back a week, and you can see where that overlap happens. This is really not enough to move HCAHPS because we weren't necessarily hitting all of the patients, and you never know who's going to get an HCAHPS survey. So the standardization that has to happen here is every single patient's got to meet with a leader.
Steve, I can imagine in this example too, there was some reluctance to adopt change to go to every patient every day. I've got so much going on, and if my goal is simply every patient every day, that doesn't mean a whole lot to me. Really what we're talking about is staff needing to adopt change and will adopt change based on emotion much more quickly than on the numbers. So if my goal is to increase HCAHPS and I'm a department manager, okay, I get it. That's one thing. But if my goal is to visit with every patient every day because they deserve a visit from the manager and they deserve the best care, that's a heck of a lot different than moving HCAHPS.
Yeah, and I think I know when you go out and you're coaching, Michael, you talk about, which patient today deserves to be met with, deserves a leader come out and visit with them.
Does a patient on the weekend deserve a round? Of course they do. Oftentimes we see rounding happening during the week.
Right.
It's a good point.
So the word deserve is emotional, right? So, and that's where it kind of flips. So we might be out there coaching and talking about you have to go out and round, this has to happen. But you're saying who deserves to have a visit from me? You've just made a switch right there, and it's an emotional one. So what we're really talking about is, as leaders, process, of course, is important, and we want to create great strategy, and great strategy is that standardization. The thing is once we want to go out and deliver this with our teams, we're going to have to take that into action. We're going to have to start tapping into emotion to help bring them along.
That's right. And really, what we look at is if we're into the process of changing hearts, of getting that emotional hook, then the minds and the actions will follow.
Yeah, and this is a piece that I really like. So, and forgive me because I didn't read the graphic we had on the previous one, which was, I think it was think, and then we do some analyzation, and then we create change. That's all very up here, and I'm touching my head right now. It's all very up here in my head, when really it's in the heart where that change is going to come from. And the real graphic is, first our team has to see the change, then they have to feel it, and they kind of have to understand the why. That's what's going to create change. So this is something that, as we were developing this presentation, I thought was just a kind of a neat metaphor. Emotion's going to help motivate me, typically throughout my day. And if everyone on the line could just shortly visualize your motivations from today, where you, do you feel stressed out? Do you feel hurried? Is this a half an hour on a webinar that you could have been using for other things? So you're kind of thinking, what are the 5 other things I could be doing right now? Emotion motivates. Crisis will compel you to do things. A burning platform is great, and it will actually get things moving. Deaconess Medical Center in Boston had a CEO come in years ago that had to turn the place around, and they used the burning platform of, we were in financial dire straits. If we don't turn the ship around, we're going to have to start laying people off. So they created a crisis, and that created change. However, the change came with a lot of stress, a lot of pressure, and it didn't necessarily speak to anybody, at the gut level. So what that can create, that burning platform can eventually burn out. Once the platform's gone, you kind of, what else are you going to go to? It also is really important for you to understand that this process has a starting point, but it really cannot have a finish. It's always going to be kind of the new normal. So that's why sometimes we don't even like to use the word initiative. We're starting a new patient experience initiative, a new HCAHPS initiative, because when people think of initiatives, it has a start, and usually it has an end. And, oh, yay, we hit our goal, and now we don't have to do this anymore. The thing is, we're going to have to do this. We're going to have to once we get great, we're going to have to just get better. So the way that we can start to motivate folks is start out with showing them what the end looks like. What does the achievement of goal look like? And there's really kind of two ways to go about this. We've already talked about kind of the consequences model. That's where crisis comes in. What are the consequences of not hitting this goal? It's very negative. It's very analytical. So I have to think about consequences. And then there's the identity model. Who are we? What do I believe in? Really kind of my why. And of course, I think about how I talk to my kids. And I probably use the consequences model too often. You know, do this or I'm taking away your phone. I probably do that, I don't know, eight or nine times a day. Where it really is, you know, I trust you to use your phone. However, we're not phone people. we're not the ones that use social media all the time. You start to try to tap the identity that's not something that's important to us. The identity model is also pretty neat because you can foster it with your team. So what is the identity of your unit? Are you the fun unit? Are you the unit that has the most experience? Are you the award-winning unit? Whatever that identity is, figure it out and then tap it. We are the unit that does this better than anybody else. Man, I could use that one all day long, and I could also use that for year after year after year. So,
you know, it's interesting. It really brings me back to think about the carrot or the stick. And this reinforces what we've heard in many different studies. And honestly, the carrot is a better motivator. And furthermore, if I can identify with that carrot because I'm a rabbit, that's going to have much better results even still. So I really like that. What I think I'm hearing and really what we need to focus on is if we are truly committed to change, we need to concentrate our efforts on changing the emotional motivations. Why behind this? What's going to make me change? In fact, one study suggested 60% of your focus on change needs to actually be on those emotional motivations.
Yeah, and this is, you know, this comes from John Kotter. Many of you on the line may have heard of John Kotter. Maybe you've even read the book, The Heart of Change. It's been around in the business world for many years now. So it's not really new information. However, we still always seem to go back to things like the strategy, the structure, culture, systems. These are the things that managers like to work on. It's what we learn in our MBA school. However, and John Kotter, trust me, was an MBA. But he talks about it's got to be that emotional motivation that we have to tap into to truly get sustaining change.
Wow. So we have now emotional change. We have some analytical change. It's true, we are motivated to increase our HCAHPS. We need to find some ways to get towards these goals. And one way that we do it is by setting SMART goals.
Right, and I'm cringing, and I've told this a couple times to you, Michael. I realize there's probably some people on the line right now who are rolling their eyes. SMART goals, I've heard it before. We learned it in college. Maybe we learned it in that first, corporate job we got or the first health system we joined. They talked about SMART goals. The reason that I bring it up, though, and the reason that it's still around is that I probably have these conversations 3 to 4 times a day. So we get on the phone and we talk about an organization's goals. So here's how the conversation goes. What is your goal? Well, we would like to round more. Okay, so you'd like to round more. So I just asked one question. What is your goal? They said, I'd like to round more. Why would you like to round more? That's the second question. Well, we'd like to round more because we think it will improve the patient's experience. Okay, so you'd like to improve the patient's experience. That's the second question. The third question is, why do you want to change the patient's experience or improve the patient's experience? Well, we think it will have a good outcome and it'll improve our HCAHPS. Okay, so after 3 questions, we finally dove into the real meat of the goal, the one that's specific, the one that's measurable. It's we'd like to improve our HCAHPS scores. So Michael, if I told you that you could improve HCAHPS scores, but you don't have to do any more rounding at all, would you like that?
Well, I'm going to take the least path to resistance.
Right, because you don't have enough time, right?
I need to improve HCAHPS.
Exactly. So I'm pretty sure this organization doesn't want to round more. They want to improve HCAHPS, and they want to use the best practices, the best evidence to be able to do that.
Sure.
So we talked about tying the goals to the team identity. So what is our goal? Well, if you're the most fun, guess who has fun? Those folks that are meeting their goals. Guess who wins awards? Guess who gets to do the poster board at the next conference because they saw such amazing improvement within their department? The folks that are meeting their goals. So that's how you can really tie it to your identity as a team. You also want to, of course, do some quick wins. You've likely all heard this before, but come on, when it comes to a quick win, if there's something that you can fix in that first week and then celebrate the heck out of it, here at the office, we play a song when we hit a goal. We play a song and we celebrate it, and we do it all of the time. And it's funny, it's been the same song for 2 years, and people still get smiles on their faces when we do it. So it works.
Great points, Steve and Michael. So real quick, I'm going to jump in here and ask another poll question. I'm going to mix it up this time, though. Make sure you're paying attention. Instead of bringing up a poll, we'd actually like you to answer this question in the chat menu on the right-hand side. So we'll give you a few seconds here to go ahead and type your message in there.
So Michael, let's help them out a little bit.
Sure.
Some ideas of quick wins that we've seen.
Sure. I mean, one of the simplest, quickest win is harvesting voice of the patient recognition for staff. We have majority department managers here, and we are trained to find and fix problems in healthcare. We're oftentimes overlooking the recognitions, the positives.
Yeah.
And so one of the easiest things that we can do to have a positive, immediate impact is to get that recognition and share it.
So everybody go out, ask the patient once a day, is there anyone you'd like to recognize? At the end of the week, we all huddle back together, or maybe it's the beginning of the next week. And how many recognitions do we have? Man, we got 80 recognitions this week. Sure, I would celebrate that.
Sure. You know, learning something new about a patient is another one that people can set on an individual basis. To go in as a leader, I want to find out one thing about this person and share that with the rest of the care team. Some really neat small things that can get quick wins.
Well, and the other quick wins piece, I know we do this in our department because it has to be something that's within your control. We don't have to go up to corporate. We don't have to talk to administrators about, hey, maybe we please get more of X. What can we fix on our own, and we don't have to ask permission.
Mm-hmm.
All right, so it looks like we have a couple coming in through the questions panel.
Yeah, I'm curious to see what other people are working on. We can add it to our list.
Yeah, so one of them is share verbatim comments from the Health Stream reports in monthly newsletter.
Yeah, so the verbatim comments is great. We actually do a daily report that goes out. So in the morning, managers are able to capture what happened yesterday in the verbatim comments through the rounds that happened yesterday. And how fun is it to be able to congratulate my team the next morning and say, hey, here's what someone said about you yesterday.
Great. Another one that came through is recognize staff mentioned in patient surveys. So coming back to that recognition point.
Yeah, absolutely. All right. Okay.
We also have one that's, we have a shout out board in our department coming in from patients and families. So again, that recognition piece, that's fantastic.
Yeah, it's a great way to start the momentum. And then, well, we'll talk in a minute about maybe the next environmental things you might be able to do.
And we also have sending thank you notes to our team from the managers or for managing up.
So, and we've seen that done in a couple different ways. Like I said, we can capture real-time thank yous, real-time recognitions, and then congratulate the person in real time because that gives them a little lift that day. And then, of course, sending the thank you notes. Our sister company, the Studer Group, coaches on that. And, man, I remember, I think I've gotten 2 handwritten thank you cards in the last year. I'm ashamed to say I may have only written 1. It means a lot, and more so now.
Well, thank you all for participating. There's still a few more coming in, so we'll be reading those on our back end, but we're going to keep moving through the presentation. So keep sharing those. We love hearing these, and thank you all for participating.
So one last note on this slide, and we've added this HCAHPS piece, and HCAHPS, what I'm calling realities. I wanted to help maybe set expectations as well. So when you're trying to improve HCAHPS, and of course, because we're a rounding technology company, we're talking today about rounding. One of the things, and one of the wins that goes in the win column, might not be a quick uplift in scores, but it might just be reduction in variability. So this is an organization where we started working with this organization in July of last year. And over the course of the next several months, what we saw is a huge reduction in variability. This organization was overjoyed at that outcome. Because if you take a look at the zigzag that was happening, they were celebrating the high highs, but when they hit the low lows, everyone was kind of, looking at the ground and their hands in their pockets. So knowing that this organization or this particular unit can hit a 63 on a standard basis, month after week after week, month after month, That then allows me to set the goal of maybe it's a 67 that's achievable. I wouldn't have known that by all of the variability that was happening prior. So this is a win.
And so what this means to me, Steve, if we think about actually creating change with HCAHPS, we should expect first to see some standardization of the actual trends themselves, and then understand what we're working with and be able to measure those changes then going forward. What sort of time frame are we looking at here? I mean, no two people are the same, but to keep it smart, we want to keep it, time-based.
Time-based, yeah. So, 3 months, especially with the nature of patient experience surveys and when they come back, it's usually going to take at least that long to start to kind of see what's happening out on the HCAHPS side.
Yeah.
Of course, with the rounding data, we're able to, and we're doing every patient every day, you're talking about on one unit, if you've got 80 or 100 patients in that unit on a week, you could have 80 to 100 data points, and in that case, you might start seeing change in as little as 2 to 3 weeks.
Got it. Well, that's useful.
Real quick, I'm going to jump in. Steve, can you speak to the last bullet on that chart where you see that dip there?
I wonder if someone asked about that. I was going to jump in because a colleague said, I don't like how it goes down there at the end. You have to take a look at the N. So that's January of 2017, and we have not updated that yet, but the N was 8 returned surveys. So when we update that, you'll see that the regular N was a little bit closer to 60 returned surveys. And once we got the 60 returned surveys, that continued to level out.
Great, thank you.
Great. So we do have some goals now. We've talked about quick wins. What are some of the ways that we can get quick wins? Well, some of the easiest, as we hinted at, are simple things that we can adjust in the environment. Steve, take us through a couple tactics that you've seen work well.
Yeah, it was pretty neat to hear everybody's feedback that they're really looking at, the recognition pieces, the shout outs, the thank you notes. There's some other things that we can do after that. So the first few weeks of this initiative, those are great. Let's keep the recognitions coming. But beyond that, you can also start to adjust the environment a little bit. What environmentally is going on? And that's one of the things that we do during rounds. We do environmental scans, whether it's the whiteboard, whether it's just the physical space in the room. This allows you to start doing some lean work without having to bring in your black belts. This doesn't require an outside team to come help out. Because we're capturing some of this, we can find out are there little tweaks that we can make? So in this case, we were working with an emergency room group, and the emergency room group was struggling with wait times after the patient had been roomed. So what was happening is typically a nurse would room the patient, take vitals, and then maybe order a couple of tests. A half an hour later, when the physician was finally freed up, the physician would come in, see the results from the test, but then also say, we probably need these 3 or 4 other tests. What they did is they flipped the environment. They had sent the physician in first. The physician was able to order some of those extra tests that he or she thought were important. And what happened is we cut the wait times way, way down. They made an environmental change. They shifted that environment that had just a huge impact on patient experience. And it was something that was within their control. They could do it pretty quickly.
The thing that I think is neat about that example is it didn't take anyone any extra time.
Right.
It was just allocating the time in different places.
How are we spending our day? Exactly, and where can we make little tweaks that will build up to really, really big changes?
Yeah, wow, that's a great example. Well, so we have some change. Change has occurred. How do we sustain the change so that this is not just a flavor of the moment?
Right, so number one, I talked about initiatives. Initiatives in people's minds a lot of times have endpoints, and they really can't. So we've got to create standard work. Gosh, that sounds horrible. Standard work. However, we have to standardizing the process. You can still have meaningful conversations. I know, Michael, you coach on using a standard work like a round, but having a meaningful conversation.
Absolutely. So within a standard set of work, rounding, nurse leader rounding on patients, one of the items in there is to have a conversation, which is very unstructured and unstandardized. So at least people have the framework in which to operate, but they still have the freedom to have something that is non-standard, which is a conversation.
And we want to point that out because we're talking about high reliability. We want to create a standard process, but that doesn't mean that you lose all your humanity while you're doing the standard process. So one of the pieces of standard work, and we hear a lot of times, I don't have the time for this, or I'm not sure where I'm going to fit this in. One of the things that can work really well is walk your team through their day. And a lot of times this has to happen individually. But if you walk me through your morning, well, I come in, I check the schedule, I see who are in the rooms, I update myself on patients. One of the things that you can do is you can start to walk through that day and you can set what they call action triggers. So if you want to create a habit, and I've actually, since I've learned about this, started using this in my day-to-day life because I need to get out and run more. You can set an action trigger. So if it is, I pour myself coffee every day at 9. Michael, you had another example.
Yeah, one example that this reminds me of is we were talking about finding the time to round. There's never enough time, obviously, and started talking about where time goes. And it turned out a lot of time gets sucked into email. Yeah. And so an action trigger for this particular nurse manager was as soon as I get in, I used to turn on my laptop and check my email. Now as soon as I get in, I think about the laptop, but I remember my patients, and I head out and I round there. The emails will be there, but the most important thing is checking in on the unit and seeing what I need to address. And a lot of what they were able to do is find and fix problems ahead of time before it came to be a problem that you would hear about via email. A neat action trigger there. The other thing that I think is really important here is just to recognize again the importance of real-time recognition. I mean, 83% of employees said real-time recognition is better than rewards or gifts. The greatest part about that is that it costs nothing to do real-time recognition. It only has benefits, both to the person giving and receiving the recognition.
Yeah, and I think this is a cultural shift that we're all, maybe some of us are still getting used to. It's not necessarily the corner office anymore. It's not all the trappings of kind of a successful career. It is, did I get a pat on the back today? Did someone recognize me for the work that I did? It has huge value. It's a dopamine burst, right? And the thing is that those are fleeting. The dopamine lasts about 5 seconds in the brain and then it's gone. And so this leads me to the idea of also praising. I had a colleague who I respect a lot, and I had a boss, and my boss said that she did not like to praise often. She didn't want to praise often because she was worried that I'd get too used to it, that it would have a dilutive effect. And I think that this is how a lot of managers think. If I overpraise, they're going to think I'm easy. And then like I said, this other colleague of mine, whom I have great respect for, said, praise all you want. He's like, I literally believe that you can't praise enough. And it reminds me of a leader in a large health system that we work with, and she calls them love credits. And she says that she kind of creates this bank of love credits because she will praise you. She will say things that she remembers about you from the last time we talked. And the remarkable thing is that she'll kind of butter you up. It's specific and it's sincere. That's incredibly important. It's always sincere. Yeah. She always picks out something. Steve, you wrote this thing, or Steve, you said this thing that really, really impressed me. So she's specific. And then she flips it on me and she's like, and I need 20 pages. I need a 20-page report, and I need it by 5 o'clock tonight. And you know how I react to that? I better get to work. I gotta give these 20 pages to her by 5 because I feel so good about our relationship, and I don't want to let her down. And that, I think, is the real payoff for praising, specifically praising, is because people then have this good feeling about you. And then when you ask them for the hard thing, they're like, I will absolutely do that for you because I know that you care about me.
That's it. Great. Well, we've gone on quite a journey today, Steve. Thanks for bringing us, and Katie, thank you as well. And thanks to all of you for your feedback. Where we've gone is we really started out with a process and trying to work towards this concept of high reliability. We spent a lot of time talking about the emotion and really being that driver of change and focusing on that within this rigid structure. We have to focus on the people and their desires. We talked about goals. We also talked about those quick wins in adjusting the environment, and finally started to hint at some tactics to sustain the change. Essentially, we're raising the bar and need to maintain that new level, not just turn things off and go back to the way they were. Thanks again. Katie?
Yeah, and one of those things, we would be happy to talk to, I'm looking at project leaders, department managers. If you've got a goal that you're trying to hit, we here at My Rounding would be very happy to sit down on the phone and walk through that process with you. If it results in us working with you, that's great. If it doesn't, and it just allows us to help you kind of focus in on how you're going to attack that project, please give us a call. We would be really happy to consult with you on goals, and then how do you get your team on board to come along for the ride.
Great. Well, thank you both. Again, thank you, Steve and Michael, for joining us today and sharing all of your knowledge and stories. I do have a couple of housekeeping things to get to before we get to the questions. But as a reminder, if you do have questions, please go ahead and ask them in that questions box on the right-hand side where we were chatting earlier about your different initiatives or wins. But before we do that, if you do have any additional questions after this, please feel free to email us at info@myrounding.com. It will actually go to Steve, and we will make sure that it gets to whoever needs to answer it so that we get you a really solid answer. Also, if you want a copy of this presentation or a webinar recording, the slides are currently up on our SlideShare page. That's slideshare.net/myrounding. And then the webinar recording will be available either later today or tomorrow, and you will receive a link in an email from GoToWebinar once that is available. Otherwise, when you close your webinar session here, you'll be prompted with a very short survey. I think it's 3 questions, super quick. If you wouldn't mind just taking a minute to answer that for us, it helps us improve our webinars for the future and make sure that you're getting the content that you want. So with that, I think we have a couple of questions in our questions panel. Again, make sure that you're typing those in as you come up with them. The first question is, how does providing recognition help me as a leader?
That's a great question. I think in this day and age, honestly, there's nothing but help to you. Steve mentioned the love bank, and I honestly believe that it does help you as a manager to be able to point out the positive just as well as it does the areas for improvement. Both of those together help our team to grow, and so recognition is crucial to your role as a manager, and hopefully it's not entirely new, but it might be something you need to bring back to the forefront to remember how valuable your voice is to your team with a very simple 2 words: thank you.
Well, and as a leader, you're going to have to deliver criticism once in a while too. That criticism is going to be a lot better received if you've done a really good job of recognizing the good stuff people have been doing.
Right.
Before you deliver criticism.
Absolutely.
Sure, great points. Next question is, how do you balance the analytics and the emotional aspects of these change initiatives?
The analytics versus emotional, I think what we've identified is that the front end of this process is analytical. It's going to be. That's how you create really good strategy, and then you create process. But to Michael's point, if the process becomes rounding, it's standard, and yet you can have a really good organic and comfortable conversation inside of the process. We're trying to identify the why here for your team. Why do we care about this emotionally? That's the piece that's going to engage them to have them start to adopt this standard process.
Definitely.
Great. We have another question here. The ebook talks about visualization. Could you talk a little bit more to that?
Yeah, we were having a conversation, Michael and I, just before we started, because it seems sometimes maybe a little bit silly to sit and visualize perhaps office work. Is it really going to benefit us? But Michael, I know you've got experience. You were a collegiate athlete. You were a gymnast, and I'm sure that you were visualizing a routine before you go and do it.
Absolutely, it was part of the workout. It was part of our daily exercise. If you think back to the Olympics, every time that you see an athlete closing their eyes before their event, they're visualizing what they're going to accomplish. They're visualizing crossing the finish line, sticking the landing, etc. And if it wasn't working, if it wasn't having a positive impact, then people wouldn't be doing it. We're just taking this proven practice and applying it in an area that we haven't thought of it before, so it feels strange. But I'm confident that the same results will be there. We need to get in the practice of visualizing the change that we want to see.
Yeah, and I think I might feel a little bit foolish, moving my hands and thinking about talking to one of my colleagues at work. However, I do know that on the drive into work in the morning, a lot of times I'll think about if I have to have a hard conversation or I need to talk to somebody about something, try to visualize how that might go, and what it might look like if it's successful. It can have a big change.
Yep.
Great. So those are the current questions that we have. I know it takes a little bit of time to type out some of these questions sometimes, so we will stick around for a few more minutes just in case you have more questions. Please feel free to add those into the questions box on the right. And again, just a reminder that the copy of the presentation is available at slideshare.net/myrounding, and a webinar recording will be available on our website www.myrounding.com starting probably tomorrow, but you will receive a link to that once it's available. And thank you again for everybody for attending. We hope that you got a lot out of it.
Thanks, everyone.
It's a pleasure.